Right, gentlemen over 60, listen up. Here's something that might surprise you. Recent studies have shown that circumcision can reduce the risk of HIV transmission by up to 60%. Sounds brilliant, doesn't it? But here's what most doctors won't tell you straight away. There are serious consequences that can affect your sensitivity, your pleasure, and aspects of your intimate life that can never be reversed. I'm Dr. Sophie Caldwell, and I've been a urologist for over 30 years, working specifically with men over 60. After 3 decades of listening to doubts, fears, and frankly, a lot of myths about foreskin, I've decided to record this video to explain everything you need to know without any taboos, without judgment, just facts. This is a quiet question that follows many men throughout their lives. To have or not to have a foreskin, it genuinely affects your intimate health, your pleasure, and your sexual function. And today, we're going to talk about it openly. Now, before we dive in, I'd like you to do something for me. Write in the comments how old you are and where you're from. This helps me understand who's watching and allows me to tailor future content more precisely to your needs. Right, let's get started. The foreskin, also known medically as the prepuce, is a thin elastic fold of skin that naturally covers the glans, the sensitive part at the end of the penis. According to a World Health Organization report, approximately 37% of men worldwide are circumcised, whilst around 63% retain their foreskin. For centuries, this topic has been hushed up due to tradition, religion, and shame. But today, with access to proper science and quality information, we can finally answer clearly. Yes, there is a difference, and it can significantly impact your hygiene, sensitivity, and even protection against certain diseases. In this video, you'll learn what the foreskin actually does in your body, what the real consequences of circumcision are, both positive and negative, and in which cases it truly may be a necessary medical decision. No speculation, no taboos, no exaggeration. Just facts so you can genuinely understand your own body and take better care of your intimate health, especially after 60. So, what does the foreskin actually do? Many people consider the foreskin an insignificant detail, but it's a natural part of the male anatomy with clearly defined functions that are present from birth. The technical name is a double-layered skin fold. It's 2 layers of skin that cover the glans of the penis, and in the first years of life, it usually doesn't fully retract yet. Over time, it gradually separates and begins to perform an active protective function. But that's not where its role ends. The foreskin has 3 primary functions. First, protection. It acts as a natural shield that protects the glans from constant friction against clothing and from exposure to microorganisms, dirt, and irritating substances. Think of it like a built-in protective covering. Second, moisturization. On the inner side of the foreskin, there are glands that help keep the glans moist and protected. This natural moisture helps maintain the local microflora and reduces friction during intimate contact. It's nature's own lubricant, if you will. Third, sensitivity. Anatomical studies show that the foreskin contains thousands of fine nerve endings that are extremely sensitive to light touch. This means that for many men, it directly participates in pleasure response and sexual arousal. It's not just skin, it's a sensory organ in its own right. These 3 functions, protection, moisturization, and sensation, explain why the presence or absence of foreskin can genuinely affect a man's intimate health and sexual sensations. Now, you might be thinking, well, if it has all these functions, why would anyone remove it? That's exactly what we're going to explore next. Medical benefits of foreskin removal. The removal of the foreskin, what we call circumcision, is a straightforward surgical procedure that's been performed for thousands of years across various cultures. However, today, this question has moved beyond being purely religious or aesthetic. It's become a topic of discussion based on medical data, serious research, and public health decisions. Numerous scientific studies have shown that in some cases, circumcision can provide genuine benefits for men's health. The main ones are these. First, reduced risk of urinary infections. In circumcised men, especially in the first years of life, the risk of contracting a urinary infection is significantly lower. According to data from the Centers for Disease Control and Prevention, the CDC, this protection is particularly relevant for children and elderly people with increased susceptibility. For older gentlemen, this can be quite important. Second, lower risk of contracting certain sexually transmitted infections. Research conducted in African countries and published in The Lancet showed up to a 60% reduction in HIV risk among circumcised heterosexual men. There was also a documented decrease in human papillomavirus, HPV, which causes genital warts and penile cancer, as well as genital herpes. Now, I must stress, this doesn't mean you can throw away condoms. This is risk reduction, not elimination. Third, reduced risk of penile inflammation. Removal of the foreskin makes daily hygiene easier and reduces the accumulation of secretions, which helps prevent conditions like balanitis and posthitis, inflammation of the glands and foreskin. This is especially important for men with limited mobility or difficulties performing hygiene procedures. As we get older, these practical considerations become more relevant. Fourth, reduced risk of penile cancer. Although this disease is rare, penile cancer is directly linked to HPV presence, chronic inflammation, and poor hygiene. Since circumcision reduces the influence of these factors, it's associated with a lower risk of developing this type of tumor during one's lifetime. Fifth, improved intimate hygiene in vulnerable populations. In older age, maintaining intimate hygiene can be challenging for various reasons. Limited mobility, dependence on carers, use of incontinence products, or reduced motor skills. In such cases, having a foreskin can complicate the cleaning process and contribute to infections. Circumcision eliminates the need for retraction and deep cleaning of the glands, making daily care simpler and more effective. These benefits are documented by organizations like the WHO, CDC, and authoritative medical journals. But, and this is crucial, circumcision does not replace condoms and doesn't eliminate risks completely. It's a risk reduction measure, not an absolute guarantee. So, those are the potential benefits. Sounds pretty good so far, doesn't it? But hold on, because we need to talk about the other side of this coin. Risks and disadvantages of foreskin removal. No medical intervention is neutral. Even a procedure considered simple, like circumcision, carries risks, side effects, and irreversible consequences that need to be carefully evaluated. Below are the main points that science and clinical practice highlight as genuine disadvantages of foreskin removal, especially if the operation is performed without clear medical necessity. First, it's a surgical procedure, and it carries risks. No matter how safe the technique, circumcision is an operation, which means, like any intervention, there are risks, albeit small, of complications such as severe pain during the postoperative period, especially in adults. Bleeding at the incision site, secondary infections, especially if postoperative care isn't strictly followed. Local inflammatory reactions during healing. In experienced hands, such complications are rare, but they exist, and patients must be informed. Second, there can be technical errors in skin removal. One of the less discussed but fairly common risks is an unsatisfactory aesthetic or functional result. This happens when too much skin is removed and the penis appears shortened or tight. Too little skin is removed, requiring a repeat corrective operation. Visible scars or indentations form that cause discomfort during erection. In some cases, even with a technically correct operation, the patient experiences discomfort with the appearance, and this can affect self-esteem. I've seen this in my practice, and it's not trivial. Third, partial loss of penile sensitivity. Now, this is the big one that many of you worry about, and rightly so. The foreskin is a structure rich in nerve endings. It's estimated to contain thousands of nerve receptors sensitive to light touch, heat, and pressure, especially on the inner part. After removal, this sensitive zone disappears. Moreover, when the glans is constantly in contact with clothing and air, a process called keratinization occurs. The skin becomes rougher, drier, and less sensitive. Whilst many men report a satisfactory sex life after circumcision, others notice a genuine reduction in pleasure, arousal time, and orgasm intensity. Let me be honest with you. In my 30 years of practice, I've had patients who've said to me, "Dr. Caldwell, I wish I'd known this before." This change is subjective and varies from person to person, but it must be considered before making a final decision. One chap I treated, lovely fellow from Manchester, came to me 2 years after his circumcision. He'd had it done for medical reasons, but he told me, "The sensitivity's definitely decreased and there's less natural lubrication. The downsides outweigh the benefits for me." That's a real person's experience, not just statistics. Fourth, loss of the foreskin's natural functions. After removal, the foreskin is gone, along with 3 important biological functions. Protection of the glans from friction and microbes. Maintenance of natural lubrication that reduces friction during intimate contact. Direct participation in tactile pleasure, as its movement during sexual intercourse is, for many men, a key element of stimulation. These functions aren't compensated for by any other body structure. After removal, the foreskin doesn't regenerate, and neither do its functions. It's permanent, it's irreversible. Fifth, it can cause regret with hasty decisions. In adult men, especially if the operation is performed for aesthetic, emotional reasons, or under social pressure, regret is a genuine risk. Some men tell me they made the decision without fully understanding all the consequences, and subsequently experienced loss of identity, self-esteem, or pleasure. That's why you shouldn't rush. The decision to remove the foreskin must be thoughtful, mature, and made with full understanding of both sides. So, there you have it, the good and the not so good. Now, you might be wondering, well, when is it actually necessary? Let me explain. Cases when foreskin removal is necessary. Up to this point, we've talked about the pros and cons of circumcision in a general context, but there's a completely different situation, not related to aesthetic choice, culture, or prevention. Cases where foreskin removal is a clear medical indication, and sometimes even an urgent necessity. These conditions require a urologist's assessment and often have no definitive solution other than surgical intervention. Here are the 3 main situations. First, true phimosis. This is a condition where the foreskin cannot be fully retracted to expose the glans, even after puberty or in adulthood. In some men, phimosis is mild and doesn't cause serious problems. But when it makes daily hygiene difficult, causes pain during erection, leads to skin tears and scarring, or causes recurrent infections, surgery becomes the best option. Phimosis can affect sex life, self-confidence, and even the overall health of the penis. In such cases, foreskin removal isn't a choice, it's a treatment. Second, paraphimosis, an emergency situation. Paraphimosis occurs when the foreskin has been retracted and then cannot return to its natural position, covering the glans. A tight ring forms behind the glans that disrupts blood circulation in this area. This is a urological emergency. If not treated immediately, it can lead to severe swelling, acute pain, and in serious cases, tissue necrosis. Immediate treatment can be manual or surgical, but if paraphimosis recurs more than once, the medical recommendation is usually unequivocal. Perform circumcision to prevent recurrence. Third, chronic balanoposthitis. This is recurring inflammation of the glands, balanitis, and foreskin, posthitis, which can be caused by poor hygiene, allergies, fungi, bacteria, or dermatological diseases. When episodes are rare, treatment is done with ointments, local hygiene, antibiotics, or antifungal agents. But if they become frequent, painful, or difficult to control, foreskin removal is considered the most effective solution. Elderly men, diabetics, or people with weakened immune systems most often suffer from this chronic inflammation. Other less common situations, such as warts caused by HPV under the foreskin, fibrous scars, recurrent infections in bedridden patients, or those with neurological diseases, can also become grounds for circumcision as a therapeutic measure. In these cases, it's not about prevention and it's not about appearance. It's about solving a specific health problem that's impairing the patient's quality of life. Right, so we've covered when it's medically necessary, but what about when it's not? How do you make that decision? A personal or medical decision. After getting acquainted with the facts, a question arises. If I don't have any problems, should I have the operation? The answer is simple. It depends on the situation. In newborns, the decision is usually made by parents, often influenced by religion, culture, or for preventive purposes. In adulthood, the choice becomes more personal and should take into account 3 points. If there are symptoms or recurring inflammations, it's a medical indication. If the foreskin causes discomfort or makes hygiene difficult, surgery can improve quality of life. If the motivation is aesthetic or preventive, the choice must be conscious, with full understanding of the pros and cons. Now, let me give you a practical way to think about this. Ask yourself these questions. Do you have phimosis? Can you not retract the skin? Do you have frequent inflammations, more than 3 times a year? Is there pain during erection? Are there problems with hygiene? If you've answered yes to 2 or more of these, you should visit a urologist. That's your action step right there. There's no universal answer. Every body is an individual case, and only a urologist can give an accurate recommendation. I want to be clear about something. This decision is deeply personal. Science gives us facts, but the choice is yours. It's important that you make the decision consciously, not under pressure from anyone, whether that's family, society, or even well-meaning friends down at the pub. I've had patients who've told me they felt pressured by cultural expectations, by their partners, even by online forums. Don't let that happen to you. Your body, your choice, but make it an informed choice. Some of you watching might have strong religious beliefs about this, and I respect that entirely. What I'm giving you here are the medical facts. How you weigh those against your personal beliefs, your values, your circumstances, that's entirely up to you. I'm not here to tell you what to do. I'm here to give you the information you need to make the best decision for yourself. Practical recommendations and conclusion. If you're experiencing pain, discomfort, having difficulty retracting the foreskin, or have already encountered recurring inflammations, don't ignore it. The first step is to see a urologist. Only a physical examination can show what's actually happening and whether foreskin removal is recommended or not. The internet can provide information, but it can't diagnose. Don't make decisions based on random opinions, forums, or external pressure. Your body deserves respect, and so does your intimate health. Look, I've been doing this for over 30 years. I've seen thousands of men, heard thousands of stories. Some men are perfectly happy after circumcision. Others regret it deeply. The difference? Usually it comes down to whether the decision was medically necessary or not, and whether the man fully understood what he was getting into. Here's what I want you to take away from this video. The foreskin has real functions: protection, moisturization, and sensitivity. Circumcision has documented medical benefits, particularly for reducing infection risks and improving hygiene in vulnerable populations. But it also has real downsides: potential loss of sensitivity, irreversible changes, and surgical risks. It's medically necessary in cases of phimosis, paraphimosis, or chronic inflammation. For everyone else, it's a personal choice that deserves careful thought. If this video has clarified things for you, please share it with other men who might be going through the same doubts silently. Men's intimate health isn't a taboo subject. It's about care. It's about awareness. It's about living well for longer. That's what we're all about here on this channel. Now, I'd love to hear from you. Did you learn something new today? Do you still have questions? Write them in the comments below. And if you found this helpful, give it a thumbs up and subscribe to the channel for more information about men's health, particularly for those of us getting on a bit. There's no shame in taking care of yourself, gentlemen. In my next video, we'll be talking about another topic that affects many men over 60, but rarely gets discussed openly. Make sure you hit that notification bell so you don't miss it. Remember, your health matters, your comfort matters, and you deserve to have all the facts before making any decision about your body. Take care of yourselves, and I'll see you in the next one.